You might have this without knowing that there's a term for it. Have you ever found that you are so distressed at the thought of having any vaginal penetration or anything even going near the vulvovaginal tissue, and that triggers off a pain? Well, that is known as vaginismus. So let me tell you a little bit about that. Vaginismus is defined as a penetration disorder in which any form of vaginal penetration is often painful or impossible. So that could be that you're trying to insert a tampon or have a speculum for a smear test, or even your partner attempts penetration either with a finger or a sex toy. Traditionally, it's been referred to as an involuntary contraction of the pelvic floor muscles due to actual or even anticipated penetration, and therefore that pain is associated with that vaginal pain that you experience. And so there is a link between the vaginal tissue and also our brain as well. So just thinking about it can trigger off pain. Now, it is far more complicated than just that. It's a condition that is massively misunderstood, and we have no clue what actually causes it, what happens. We have some woolly theories, but sometimes it's a diagnosis given when everything else has been ruled out. So you've been checked for adenomyosis, endometriosis, vulval lichen sclerosis, or genitourinary syndrome lactation, or genital syndrome of the menopause. So loads of other conditions need to be checked at the same time. Even we did a show recently where a patient said that she had a partially imperforated hymen, and that was the cause of her vulvovaginal pain. So I would say vaginismus is a neglected condition in women's health there, alongside other sexual pain disorders that women experience, such as vestibulodynia or vulvodynia or dyspareunia or vaginal atrophy. So all of these conditions unfortunately get clumped into one, where we don't actually know what causes it, and therefore we don't have targeted treatments, but we know some treatments can work. So the biggest thing when it comes to vaginismus is that women are disbelieved or misunderstood entirely, or not even examined, or actually the examination puts them going back to seeing any healthcare professional for any actual input, which impacts relationships, which impacts their self-confidence, their self-esteem. And the lack of knowledge just continues, where women are left in limbo without any treatment, but the shame and the taboo and the embarrassment of it continues. The challenge with vaginismus is it can cause a real issue if you're trying to become pregnant, and this therefore causes further distress and frustration for both partners. And women feel that actually they're to blame when their condition is impacting them in their ability to have that child that they really are longing for. But you are not broken, and you can get help. And so I'm going to talk you through some simple things or some areas that you might want to explore. So if you're struggling with the feelings of vaginismus, you are not broken, you can get help. And there are ways to manage those feelings around penetration. So the first place I would start is say, go and see your NHS GP, asking for a GP that does women's health specifically. And also when you're at that consultation, sharing your ideas, concerns and expectations, sharing whether you want to be examined on the first consultation or whether it's something that you might need to build your confidence to going and getting that done. I know that it's so hard to get an appointment with the GP. So you build yourself up, and then if that examination goes badly or doesn't go comfortably for you, it can actually put you backwards, and you might not want to go back for further examination. So I always say when it comes to vaginismus, sometimes just externally having a look before ever doing any internal examination is the only bit that you need to worry about, until we get to the idea that we actually might need to have a look on the inside. Depending on the cause, remember there's so many different reasons why you might be getting symptoms of vaginismus. Then it could be that we need to get a second opinion or also a secondary care through a pelvic health physio. They are brilliant because they will start looking at what your emotional feelings are. They've got a bit more time. They might want to try relaxation techniques such as mindfulness, pelvic floor exercises, and they might want to see how you can relax the muscles in and around your vagina and also your pelvis. Getting a referral to psychosexual therapy might be something you want to explore as a couple or also just by yourself. You don't necessarily need to be in a couple to start having psychosexual therapy. It's something that you need to do for yourself first so that you're able to relax before maybe even having that conversation with your partner. So just something to think about. Cognitive behavioral therapy can really help. This can help you to understand your thoughts and how that affects your emotions and behaviors. Remember, what's happening in and around the pelvis and also your vagina and your vulva is all linked up to here as well. So you've got to keep making that connection through your body and your brain, making sure that you're fixing that so that you're able to sort of feel relaxed and comfortable, but also be comfortable with your own body. For some vaginal dilators or vaginal massagers, they could be something that you want to try, and it could be building up your confidence through those, making sure that actually topical vaginal estrogen is going to be something that you use, as well as good lubrications and also good moisturizers as well. But be careful of the ingredients in there. Sometimes the lubricants can have glycerin in them, and that could actually trigger a thrush or even recurrent urinary tract infections. So be very careful about what you use around the vulva and vagina so that doesn't make your vaginismus worse. Penetration might be your end goal, but that might not be the thing for everybody. So look at other ways that you might find a very satisfying, intimate relationship without penetration.